What are the main factors that you think could improve someone's immunity to COVID-19 virus, and are they the same factors as would improve immunity to any virus, do you think? Maybe that question first. Do you think that if we improve immunity generally, that will improve our immunity to all viruses and COVID virus specifically?
No doubt, no doubt. However, the COVID has this, the 19 has this particular, way into the body, which is through the ACE2 receptors.
Yeah.
In fact, there are four different ways that it can get into cells, but the ACE2 is the sort of predominant one. And the problem is for us is that we very heavily express ACE2 receptors on every single blood vessel in the body. So, people are now starting to talk about the main pathology in COVID-2 as being a sort of endotheliitis. So it's the inflammation and the immune response and the damage to the endothelial cells, which is, we've got tens of thousands of miles worth of blood vessels in our body, every single one of them lined by these endothelial cells. It's a one cell thick layer of cells.
Yeah.
And if they stop working properly, then, this is why every organ in the body can be affected by the COVID-19. So if you've already got inflammation in the blood vessels, which people with metabolic syndrome, which is this overweight, high blood pressure,
Yep.
High cholesterol, high blood sugar or high insulin, then you're much more of a sitting duck for the worst outcomes. And this is why, as you've been telling us, the pre-existing conditions that keep showing up, of your hypertension, and that's an unusual one because, as you've said, people wouldn't normally think of having high blood pressure as being an immune issue or immune compromising issue, but actually it is, because the underlying issue in most people is endothelial dysfunction, and that has as its source, vitamin D deficiency is always up there. You'll always find vitamin D deficiency in much more prevalently in these groups, and because vitamin D essentially regulates your degree of non-inflammation. You want a nice, calm, balanced immune system ready to do its job if you get an injury or an infection, or dealing with a toxin or something like that. But vitamin D deficiency kind of tells the body that you must be hiding in a cave somewhere, not exposed to the sun for a long time, and so you're very vulnerable. So this is a kind of epigenetic response that and all of these things have their basis in an incredibly long period of time. Most human history is prehistory. We're talking hundreds of thousands of years during which these processes have evolved, essentially to keep us alive in the primitive world. So you have this very exaggerated immune attack, that the cytokine storm that we've been hearing about, and that's been shown to be associated with low vitamin D in many other conditions, for decades now. And the thing that frustrates me is that we're all very excited that, now the information's coming out, but actually people have been bashing on about, the need to look particularly at, immigrants in Northern European countries. And there has been some attempts, certainly in the UK, I can remember, people were talking about the need to test and supplement vitamin D levels, particularly in Islamic women who were wearing burqas and who were covered up a lot of the time.
Yeah.
When they got the chance on their own to uncover themselves, the weather was too bloody cold to make vitamin D.
Absolutely,
anyway. And here we have the other problem. The sun is so strong that you'll burn in seconds. If you've got a Celtic, Irish, sort of English rose skin complexion, you can burn in 5 minutes in the middle of the day, in the middle of our summer here.
Is there still ozone depletion in New Zealand, Matt? Is that still an issue?
Well, it's still present. The ozone hole's not getting any bigger, and it does seem that we've made a big difference with the switch over from chemicals in fridges and things like that. But it's going to be a whole bunch of years, 10 to 20 years, I think, before they say the ozone hole will go. So it still does move over us. But vitamin D certainly, I think, is the preeminent fixable. It's free. It doesn't cost anything. You can just go outdoors and get your clothes off. And you've made most of your vitamin D by about halfway to sunburn. This is your rule of thumb. Whatever your skin tone, you've made all the vitamin D you can make on any one particular day. by about halfway to sunburn. So if you're very, very dark skinned from Africa or Sri Lanka or Aboriginal or something like that, you can be outside all day.
Yeah.
And you won't get sunburn. But it takes all day to make the same amount of vitamin D that someone like you or I could make in 20 minutes, in the middle of summer. So it depends on the time of year, the angle of the sun in the sky. Once it's below about 45 degrees at midday, there's really no UV, there's no power in the sun to be able to make much vitamin D anyway. So then we rely on supplements. And
is that the same at every latitude, Mark, do you think? Is it the same, if you're in the semi-tropics or as opposed to up in the north of Canada or something? It is to do with the angle of the sun in the sky, because the more the more the rays have to go through the atmosphere. Yeah.
So the less, or the more acute the angle is, the more UV is filtered out. So usually at the tropics near the equator, you've got the sun right overhead at midday, and so you are going to burn more quickly. Our only issue down here is the ozone, really, because we're really quite far south. But it does mean there's a lot more UV for your money. But the secret is surface area, and I tell my patients to, in the warmer months, get their kid off as often as they can without being arrested, depending where they are.
Even if they do get arrested, at least they'll have plenty of vitamin D.
Well, that's right. That's right.
Yeah.
But to do it frequently, because you store vitamin D. And my concern around the recommendations now that are coming out that are saying, sure, the previously recommended daily amounts, 400 to 800 units, are probably not enough. Let's go for 1,000 or 2,000. Even that won't touch the side in somebody who's already starting off deficient, because most vitamin D is locked up in the body fat. So also, if you're overweight, also it takes a lot more vitamin D to fill up those stores before it then kind of spills out into the blood.
Yeah, so you've got to fill up all the fat cells in the body before it spills out into the blood, where it can actually be used to promote.
That's right. So we know that overweight people tend to have vitamin D levels, but also it takes a lot more vitamin D by mouth to sort of get them up to levels and then keep them there. And once you're good, once you filled your stores up, you can kind of feed off it for a while. So whatever vitamin D level you start off at the beginning of winter, it's generally dropped by about a third if you're looking at blood levels by the end of winter. So, it is fat soluble, it's stored in the fat, it does last quite a while. So, it's good to kind of get stored up. But the evidence for vitamin D supplementation in reducing respiratory disease does seem to be a bit stronger for daily supplementation rather than taking, intermittent big doses.
That's right. I mean, the traditional teaching with fat soluble vitamins is you can just take a whack of it all at the same time, take a bolus dose every couple of months, and that'll top you up, and it doesn't matter. But it is interesting that the evidence is saying daily or weekly is much more efficacious in raising vitamin levels than the occasional bolus. So it's one of those fascinating examples where a little bit of theory can underpin or undermine quite a lot of practice.
Yes, that's right. But I think we need to try and just look at what's supposed to happen in nature. What's the physiological behavior? And the idea is we're all supposed to live outdoors anyway, and be exposed daily. And the skin tone we have is a reflection of how much you need to absorb based on where your ancestral kind of line spent, 100,000 years or so.
Yeah. That's what impressed me about the vitamin D stuff, really. I mean, given that the original humans were African, therefore black, almost certainly, the only adaptive advantage in evolutionary terms to being white that I know of is that you make vitamin D more quickly.
That seems to be the whole story.
I don't know any other adaptive advantage to being white. So
so we're supposed to be, hiding in a bog somewhere. Shivering most of the time, but with this sort of lily white skin that can soak up, a lot of vitamin D. If you're doing that year round and you're agrarian, which means you're working the land anyway, you're not sitting inside an office driving a computer all day, then it was really never an issue for most of human history. But since we've become adapted and civilized, these things don't seem to matter. But I think this is really showing up actually how important it is to try and reproduce those essential basic behaviors that for millennia, kept us reasonably healthy. And so it's not just about vitamin D. And you asked about other immune things, but if I can just come back to this, looking after your blood vessels, and it really does mean that we've got to just look at the overall quality of our food. We are built from the foods we eat. We have, on a molecular level, if you ignore the bone, which has a turnover of about 7 years, we have a complete new body about every six weeks. The biomolecules that are used, there's a constant turnover. And so what are we built from? Well, everything we've eaten or drunk. So really our kind of overall average health is a reflection of the average kind of quality of what we're eating and drinking. And so much food doesn't have the mineral concentration in. It's kind of processed. And the kicker or the killer even, is if you're taking in food that doesn't bring to the party the things that the body is forced to use up to digest it and absorb it, you're left worse off. And around about a third of us is our immune system, if you look at cells in the body. And so that's going to pay a price. So,
that's amazing. About a third of cells in the body are involved in immunity.
Yeah, if you look at the blood, the bone marrow, the tissue is full of, roving sentry cells that hope most of the time they have nothing to do. So immune dysfunction is at the heart of many different diseases.
And there's lymphatic tissue everywhere, isn't there? I mean, it's
yes,
all over the body. Yeah.
So we're now starting to see. Sorry.
No. But I was going to say, if I go out in England today, so if it's a sunny day and the sun says 50, 60 degrees in the sky, which it might be this time of year.
Yeah.
And I've got my shirt off outside. How much vitamin D will I make with full body exposure in, say, about an hour's sun? If it takes me about 2-3 hours to burn.
Yeah.
At the moment in England, probably about 3 hours. Yeah. So that means like an hour and a half would be the optimum kind of exposure. Is that what you're vaguely suggesting? Is that what you're suggesting?
Yeah, where are you? You're May, aren't you? So sort of very late spring, early summer. Yeah. I mean, the most that you can make, and it does decline with age, unfortunately. The ability to actually make it and get it across the skin into the blood does decline a bit with age. But about 20,000 units.
Wow, that's a lot, isn't it?
Is a lot. That's how much we're designed to be given. Designed to make and appear in the bloodstream.
So I could make 20,000 units in a couple hours on a reasonably sunny day.
Yeah, and I could make that here in 10 minutes, in the middle of summer, if I went outside. And the point is that you don't need to be out until just before the point you sunburn. As the ironic thing about vitamin D is it's very delicate and very easily broken down again by ultraviolet light once it's been made. So it's made it's made from cholesterol, actually, the action of ultraviolet light and cholesterol on the surface of the skin. People used to think, and I was taught, and you might have been as well, that vitamin D was made right down in the sort of the basal layers of the skin.
I was taught that. True. I was taught that.
Yeah, it's actually made on the top.
So it's in the epidermis.
It's made in the oils on the top of the skin, and then it has to be absorbed through. So this is where animals get their vitamin D. They make it on the top of the skin, and they ingest it by cleaning themselves. So it's one of the reasons that they lick themselves, and one of the reasons why domestic pets
did not know that. Wow.
Get more cancer than their wild counterparts because they're vitamin D deficient, because they spend so much more time indoors. So
that's why dogs lick themselves.
It's one of the benefits of I mean, I don't know if that's exactly why they do it. I mean, we know that dogs do it because it feels nice and because they can. It's so interesting that you see this corollary and these parallels in the animal world as well. Even the odd vet I speaks to, does know about the vitamin D story in animals, and domestic pets, are descended from outdoor animals like all of us. So about 20,000 units.
I think that's 500 micrograms.
Well, it's 10 times 2,000 units, which is what you take a day.
I take 50 micrograms. 50. So it's 500 micrograms.
Yes, that's right. That's right.
So that's 0.5 of a milligram. That's like huge.
So if you or I suggested that people start taking those amounts, the authorities would come down on us like a ton of bricks. And yet that's how much you can make. and it gets in the bloodstream, and it takes about 24 hours. And here's the thing, that it's easy to go to that trouble to make vitamin D, and then you wash it all off in the shower. So I teach my patients that because it takes about 24 hours, you shouldn't really use soap on the big surface areas that have had the sun, because it's in the oil, and the soap washes the oil off, and it goes down the goes down the sink. So you can do your nappy and your armpits and things, but you don't actually need to use soap on every square inch of your skin every day. And this came out of some work looking at people who retired to Florida. They were looking for a control group of older people that they thought would have optimal vitamin D levels. So they went to Florida and they tested all these people, and a lot of them were deficient, and they couldn't figure out what the problem was. And then they then worked out that actually it was just being showered off with soap. So and there's nothing like
that either. That's right. Fascinating. Right. Thank you for that.
That's all right. And we know that a bit of dirt's really good for immunity anyway. And, this hygiene hypothesis, why so many people have allergies and asthma and things, autoimmune diseases, because maybe we're just over clean. So I think for me, the vitamin D story is it no longer even needs debate. The proof is in. We should be, getting everybody outdoors or supplemented with meaningful real world doses that actually do the job. So if you default to what nature produces, which is 20,000 units in a day, really it's pretty safe to take bigger doses.
But when the sun, when you're exposed to the sun, your skin makes vitamin D. Like if I go from a northern English climate and then I go to the Mediterranean or the tropics, then my vitamin D levels will go up and up and up and up. But then they'll get to a particular stage and they'll stop. There'll be like a homeostatic regulation. My skin will stop producing it as much.
That's right.
So I can understand that, because that's that homeostatic sort of physiological inbuilt safety mechanism.
Well,
if I'm taking it, if I'm ingesting it, will that same mechanism still work, or will it build up into toxic doses if I'm eating it?
Potentially it can. But that, in real world, that's very, very rarely seen. People like the Codex Alimentarius, the European committee that oversees and pronounces on doses that you're allowed to take, really make sure that you're not really allowed to take that much anyway. I mean, in New Zealand, you can't get more than 1,000 units per day in a supplement. I mean, people can buy a bottle and take 5 a day, which is not unheard of to do things like that. But in terms of the individual dose, the recommendations are still pretty tightly controlled. But I'll tell you, that there's a story in the literature of a mistake that was made in a compounding pharmacy in the States, and a man over there, unknowns to himself, was taking 1 million international units a day for 6 months, until he got sick. And he turned up in hospital with hypercalcemia, and they realized what had happened, and that the compounding pharmacy had made a mistake. So he was quite unwell in the end, but I mean, he got better. He needed some IV fluids to rehydrate him and things like that. And his calcium came down, and it all got better. I suspect he got a probably decent payout from that as well. But the point is that even in this person, 1 million units a day by mouth was still compatible with life. And the epidemiology that's been looking at what's the ideal level, it seems to be most associated with the prevention that you can get from cancers and depression and preserving bone mass and all these other things. And really it's 100 and above. That's the blood level that seems to be associated.
What units are you using?
Quite hard to get to.
Are you using nanograms per litre?
No, we use millimoles per mole, I think it is, or
because there's two ways to do it. There's nanomoles per litre, isn't there?
Yeah, we use the high one
per mil.
That's right. It's the nanomoles per litre.
Right. So okay.
So 100 is the easy number, and I think that's what you use in the UK as well. I think it's only
it is. Yeah. What I'll do is I'll translate that into the nanograms per. The nanograms per mil. That's what the Americans use.
Yes.
Yeah. So if I go into the sun, my levels will rise up till I get to about 100 nanomoles per liter, and then my levels will stop rising.
Yeah, if I'm testing people that work outdoors, they just want to know where they're at, and I'm wanting to show them as well that they maybe don't need to keep taking supplements or something. I might regularly see people 120, 130, and I'm really excited and really pleased when I find those readings because they're actually quite unusual. Most people are off the bottom of the scale.
Yeah.
And the consistent thing that's come out of all the research, and it's a statement that you always find at the beginning, in the summaries, was that the researchers were surprised how many people in the control group, for instance, were already deficient in vitamin D. And we know that it's very common in darker skinned people, and you can drill right down into different states or even different counties in different states. In the US, all this public health work's been done, but it doesn't seem to interest people into then putting money into solving the problem.
Yeah. So if I were to take huge doses of vitamin D, what overdose effects would I get eventually? You mentioned the high blood calcium.
You'd have to work pretty hard at it, and the Institute of Medicine, which is a division of the NIH in the States, looked at this, I think probably 10 years ago now, and they concluded that even 10,000 units a day was what they call tolerably safe, which means you're unlikely to come to any harm taking that sort of dose, even though the RDA was less than a tenth of that.
Yeah.
But of course, the recommended daily amounts are nothing. They're never about what's optimal.
No.
They represent a bare minimum that you need to avoid an obvious deficiency of that nutrient. And this is one of the other ways in that we're kind of hamstrung and end up kind of unknowingly being overcautious and ending up with deficiencies. Because I don't want to know what the bare minimum is to keep me alive. I want to know what's optimal. And so there's a big margin of safety in terms of the doses that are allowed to be put into your kind of multivitamins and things like that, and the work that's been done looking at the individual nutrients and what are optimal levels. And I agree with you entirely that people have got to be looking to their food as the first place to get their minerals and their enzymes and vitamins and things like that. Absolutely. And there have been several sort of high-profile meta-analyses over the years seeming to show that there's no benefit for most people in taking a multivitamin. And you can argue this, and it's a fascinating area. But there are hundreds of thousands of individual pieces of work sort of linking many diseases and your risk of getting them to poor nutrition or low nutrient levels, if you're looking at things individually. So I think the food choices and moving, breathing, most of the benefits of exercise come from the movement.